Hi everybody, this is Jonathan Tran from Paramic Financial.
Hey everyone, and this is Frank, also from Paramic Financial.
Welcome back to the Paramic Hour. We are back. It's been
Almost a month.
almost
I
a
think.
month. No, it's less than that.
I'm not sure. I think it was
It's been a
almost a month.
couple weeks since we did live stream. It's just been so busy with the holidays.
Mhm.
You know, happy Thanksgiving, everybody. Merry Christmas to those coming up soon. We've just been super busy with the holiday season, especially right now. As many know, it's Frank's favorite time of the year. It's healthcare season, and it's been running from what days to what days, Frank?
So normally the previous year is running from November 1st to December 15th, but for this year they give us extra time, so it's November 1st to January 15th.
Got it. And then the special enrollment dates to get it effective by January 1st is?
December 15th.
And then for February 1st is?
So if you want to use by February 1st is from after December 15th to January 15th.
Got it.
Uh-huh.
So we do have some time, but if you don't want a gap of 1 month insurance, make sure you do it before December 15th. It's only a week away.
Yes.
So that's why we're so busy this year, because at first we thought that we have all the way until January 15th to retro it back to the 1st, but the insurance companies are pretty smart. They want it done 15 days before. So basically, if you are applying for individual health insurance, you have until December 15th for the first, and then January 15th for the second month.
Correct.
Now, just some information about what's been going on. So the healthcare.gov sends us updates every week to let us know how many people have enrolled already. And so far, it's been about 4 weeks, right, Frank?
It's been about 4 weeks.
Yeah. So as of this date, there's 33 states that are participating in the marketplace here through healthcare.gov. And they said about 3 million people have selected plans. Now, 3 million people have selected plans, but it doesn't mean that 3 million people are enrolled. From the last time Frank told me, I think last year we have a total about 10 million people enrolled in health insurance, something like that.
Just last year, yeah.
Yeah, last year. So this year alone, we're almost near the end of the season, and we've only enrolled in 3 million. Why do you think that's a lot lower this year, Frank?
I think partly because of the reason, besides the reason that people have been busy going back to work, so they've been, delaying and procrastinating. That's one reason for me, because, I've been following up with a lot of customers, and they're like, oh, Frank, give me more time. I'm so busy working. I just got my job back. So, we understand that, right?
Yeah.
And the second reason why I think so is because this year, the premiums have gone up slightly a little bit more than for previous years. So customers are having more of a hard time selecting the plans that they want that fits their budgets, but also at the same time that fit their needs. Right. So they kind of, on the fence and trying to weigh the best options for them. So they're taking more time on this one.
Yeah, I think you're right. Real quick here, hi Koltan, happy birthday, Ko.
Hi Mom, happy birthday,
Me
love
too,
you.
Frank's
Let's
gonna
go
take you
for-
out today
yes.
for dinner, okay? So
don't eat anything
don't
from
eat.
now until midnight.
Yeah, so enjoy your dinner. Happy birthday. Thank you for always supporting us and referring us your friends and family. We really appreciate it. Wish you happy birthday and lots of fun and enjoyment. So hope you enjoy dinner tonight.
I'll buy some chicken nuggets.
Yeah, I'm about to say you should buy the inflated, inflation hit chicken nuggets that are no longer $4 for 20 nuggets. Now it's $8.
It's $8.
Or $7.99. Just
I don't mind paying that $4 extra. It's her special day, so I'll let her have it.
Cheap, bro.
No, I'm kidding, Mom. I'm taking you to a fancy restaurant tonight.
Oh, he said it.
Yes.
Okay, so happy birthday, Ko, and hope you enjoy your day today. So back to your healthcare, Frank. You're right. A lot of the premium now. It's kind of like a two-way thing, right? So with the healthcare this year, everybody, last year, a lot of people have already forgotten that mid-year, Biden passed the American Rescue Act, and there was more money being put into the marketplace or individual health insurance space to help lower your premiums. So all of a sudden, everybody is paying a lot less money on their health insurance. And now that a new year is coming, we don't have that COVID money anymore. So then the price has gone back up. And so a lot of people are like, oh, why is it going back up? Well, realistically, it's going back to what it's supposed to be because you got COVID money last year. So just, don't shoot your agent yet, but just, understand a little bit that you are losing the COVID credits that they were giving you last year, hence why you see the insurance going up a little bit. Now, there are companies that have been in the marketplace for quite some time, right? And so maybe they're overexposed. And so now that they feel that they have enough customer base already, or maybe they paid too many claims, they start to raise up their price. And now you're seeing a lot of new companies that are showing up in the marketplace now that are very competitive, have very attractive deductibles, co-pays, and you may want to check them out. But the issue with the new companies is not because they're a bad company or they're new, it's just that the doctors haven't had a chance, they've been so busy that they haven't had a chance to get into network with these insurance companies.
Yes,
right?
correct.
And so some of the doctors are either waiting to get approved to get these policies, get these insurance companies approved for them to take their insurance. And some doctors just like too much hassle, they don't even want to deal with it.
Yes.
Right? And they're not up to date what's going on. But I'm sure once those doctors start seeing that nobody's coming back, they're going to be going looking for those insurance companies to enroll them, right? So it's important to, if you're watching this live stream, make sure that you hear what I'm saying. Talk to your doctor. Tell your doctors like, hey, I heard there's the new marketplace plans. Are you enrolled in these plans? Because sometimes doctors are so busy they don't know.
Yes.
Right? And maybe it's a last minute thing and they're trying to get enrolled in. So I think a lot of reasons why there's like 3 million people that have selected plans, but not everybody has enrolled per se into the plans, because a lot of people are waiting to see like, is my doctor going to take this? Is this plan going to be good? And people are doing more research. And like Frank said, a lot of people are busy so that they don't have time to do it. So, but our office, we do health insurance. So if you guys do need some assistance with selecting your plans or checking your doctor to see if there's taken, please contact us at the number below or shoot us a message on Facebook and we'll have somebody talk to you and help you with that. Right, we're always here to help you guys out. Even if you have another agent and you want to switch agents, we can help you. Or if you just want to ask a simple question, please message us or call us. Okay. Yes. But to support our stream too, please, follow our Facebook page, follow our YouTube page. You should see it on the page below, and we will pop up every once in a while our YouTube page and also our Facebook page. Just make sure you go on there, you like it, and you follow us. And that supports us a lot so that we can get more viewers and we can share more information to people. But today's topic is going to still be around healthcare. But before we go into that, Frank, I want to go over like of that 3 million number that's been enrolled so far for the week 4 of healthcare season. Can you give us a little bit of a breakdown of what those numbers look like?
Yes. So the week 4 is going to be from November 21st to November 27th. And as far as plan selections go, there are about 500,000 people selected a plan. But like Jonathan said, they might have selected a plan. It doesn't mean they have enrolled yet. So they're still waiting on a confirmation or just procrastinating. For the new customers who are enrolling for the first time, new consumers, this number is about 123,000 people. So those are the new consumers on the marketplace plan that they haven't bought before. And for the consumers renewing coverage is about 445,000 people. And let's see the consumers. And as far as the applications submitted, we're at week 4, we're at about 716,000 applications submitted.
Wow. So it looks like most of the people that are renewing already, and we have a lot of applications that are submitted, but it seems like not a lot of new people, right?
Not yet.
So majority of the people that are applying in these 3 million numbers is mostly the existing people and renewing.
Correct.
So if you guys know anybody who needs health insurance, it's very important to protect yourself. Especially if you have a lower income, you could qualify for very low coverage or free coverage, depending on your family household and also depending on how much money you make. So, don't go without health insurance, because what if you have like an emergency happen and you have to go into the hospital, and then you got hit with a big bill and you can't pay it. Now it affects your credit. And if you're trying to buy a house, especially in this market right now, everybody's trying to buy a house, and your credit got hit, you're not going to be able to buy that house.
Yes.
Right? You're trying to buy a car, you can't buy a car. Right? So you don't want to take a chance when you don't have to. Right? So just make sure that you take the time to protect yourself. These are individual plans. Now, for those of you who own your own company and you have employees and you want to look into a group plan for your employees, there are options out there as well. There's a lot of good plans out there for group plans, and you can have access to more than just HMO plans. You can get PPO plans and whatnot. So give us a call. Let us know if you have questions around group plans. But for today, the reason why I want to bring up our topic today of long-term care, and I'm pretty sure you guys, if you guys follow our live stream, you've heard us talk about long-term care before. And long-term care basically is not covered by your health insurance.
Yes.
Yeah, so basically when you become critically ill, or you become disabled or chronically ill, where you cannot take care of yourself and you cannot do 2 out of the 6 daily living activities, then you can qualify through your doctor for long-term care. And when you have long-term care, that cost is on your own.
Okay.
Right? So especially if you're under 65, you don't have any long-term care coverage at all. If you're 65 and up and you have Medicare, then you may have a stipend of how much benefit that you could use before you have to pay on your own, right? But they don't cover you 100%, and they don't cover the way you want. You have to do it the way they want, right? And sometimes they may not even give it to you consecutive days of coverage, when maybe you need 3-4 months of coverage, but they're only going to give you 1 week.
Oh.
Right? So to plan for long-term care is very, very important. Just think of it now as that you're putting in $1 now, and maybe, depending how you do it, if you do it right, when you get time that you have to use it, maybe that $1 of yours now stretched to $3, stretched to $4, $5, $6, depending on how long and how well you plan ahead.
Correct.
Right? So imagine if you have $100,000 in your savings for your retirement, but then you get hit with this long-term care issue, and now you got to pay for all these long-term care costs, which we'll talk about, then you're going to run out of that $100,000 really quick,
Yes.
right? But if you have that long-term care, now you stretch your money. Maybe you put out some money on the side, and now you're stretching your money, hopefully 4 to 6 times what you put in. That could really save that piggy bank of yours when the time comes when you need it, right?
Yes.
So planning for long-term care is so important, but much like other things in life, you must plan for it before it happens. If you wait until it happens, they're not going to give it to you, right? Because they're going to lose if they give it to you. So you have to plan ahead while you still can, right? Because if you don't plan ahead and then you start to have health issues, one, it could be that you don't qualify at all, or it becomes very, very expensive.
Yes.
Right, Frank?
And if you watch our last live stream, me and Jonathan, we talked about statistically, about 70% of people who are over 65 in the US go under long-term care when they're over 65, more than half the people. So it's something, to think about.
Yeah, my family right now, we're experiencing it, and I'm pretty sure those of you who have elders in your family probably have gone through it as well. When older people, they get older, their health deteriorates. Sometimes their mental capacity deteriorates as well, and they cannot take care of themselves anymore, and they need people to take care of them. So the first people they turn to is their family, right? And of course, if it's your children or your grandchildren, they love you, they want to take care of you, right? But then it also puts another stress on them as well, because now they have to balance their work life, their family life, and taking care of their parents or taking care of their loved ones, and it can be draining for them, right? And sometimes having that extra help or having the funding so that you can hire the right people, the people you want to take care of your loved ones, can be very, de-stressing for you, because now you don't have to worry about the money portion, right? Because it all comes down to how much money you have.
Yes.
If you're relying on the government to take care of it for you, well, they're only going to take care of so much, and they're only going to give you so much access, and you may not be able to hire the people you want because maybe the government only pays X dollars for someone to take care of that person, and when the person comes and they look at the case, they're like, whoa, this is a lot of work, and they're only paying me this much. It may not be worth it for them to do it, right? So that's why having long-term care gives you more control, that you could hire whoever you want to the quality that you want, and you can be living where you want if you plan well enough, right? So today we're going to talk about that. I know long-term care is a nationwide issue, but we're going to talk more about Texas because that's where we live in. But the sources that we get it from, you can go online, you can go to some of the websites that we use to source some of this information, and you can look up your own state, and they can, you can look state specific what you need to do, right? But many times, state government agencies will have assistance in terms of finding information about these things. So if you go to your state website for the healthcare, they should have these information for you as well.
Yes.
Right. So Frank, can you tell us a little bit about kind of like the statistics on long-term care in the state of Texas and where it stands right now?
Yes, and Jonathan. So in the state of Texas right now, at the moment, there are over 1,200 certified nursing care facilities. The occupancy rate at Texas facilities is at or just above 68%. In Texas, there are approximately about 136,000 assisted care or nursing home beds in those 1,200 plus facilities. Approximately 94,000 residents reside in those nursing care facilities. This number will vary from year to year and month to month. And if you need more information, you can always go to www.cdc.gov to get more statistics. For the cost-wise, the average cost in Texas for an assisted living or nursing home care is approximately around $3,600, with an additional cost of $1,500 to $2,000 for dementia or Alzheimer's care needs on a monthly basis.
Wow.
So you're looking at probably around $5,000 on average on a monthly basis.
For someone who has dementia?
For someone who has Alzheimer or dementia.
Wow. So $5,000 a month. So let's just say that we have 30 days in the month. So that's $166 a day. And let's just say that's 4 hours of work. That's about $40 an hour.
Yes.
Right? So I think that the state ain't going to pay $40 an hour, that's for sure.
No way.
Right? Maybe pay half.
They might. And like you said, it's not even consecutive.
Yeah. So see, just what Frank say is that how many beds are being used right now, Frank?
About 1,200 in those facilities.
So 94,000 divided by 136. So about 70% capacity right now.
Wow.
Right? So in the state of Texas, we have about, he says 136,000 licensed beds in the state of Texas. 136,000. That's not a lot, and 70% of them are filled up already. Because the reason why is either one, some of these facilities are mixed, like Medicare facilities, Medicaid facilities. Some of them are private facilities. And a lot of times it's not filled up because one, people don't know where to get their benefits from so that they can utilize the benefits. Or two, they don't have money to go into these facilities, right?
Yes.
And so planning ahead of time for that is very, very important. But just think of it right now. Right now, they're already at a 70% occupancy rate. There's only 30% available to you. And that 30%, you don't even know what kind is available to you until you go out and look for it, right? Or if it is to your liking.
Yeah.
So if you're relying on the government to take care of it for you, you have limited choices.
Yes.
Right? So that's why planning for long-term care ahead of time is going to be very important. The cost of $5,000 a month, if you have a special condition case, even $3,500 a month is still very expensive because that's double the mortgage, a standard mortgage in the state of Texas right now. Right? If you have a house that's about $200,000, your mortgage is roughly about $1,800 a month. Right? And now you got to pay $3,500 a month for care. That's double the mortgage.
Correct.
So that's very expensive, even in the state of Texas, because if your mortgage for a $200,000 house is already $1,800, for that's including taxes and insurance and stuff, that's a lot, right? And when you're retired, you're on limited income. You're on fixed income, so that's tough. Now, so let's talking about limited income. Frank, can you talk a little bit about Medicare and Medicaid in the state of Texas right now?
Yes. Okay, so for Medicare/Medicaid accepted in nursing homes in Texas as of right now, the Medicare Part A may include coverage as at a skilled nursing facility if the patient requires skilled medical care. The nursing home care is generally referred to as a custodial care and will not be covered by Medicare. Okay, so it will not be covered by Medicare.
Oh.
And Medicaid payments, once applied for, will begin when the nursing home or assisted living resident had exhausted all other means of payment, such as private funds and or long-term care health insurance. In other words, when the patient no longer has any other means of payment, Medicaid takes over in a Medicaid certified nursing facility. Okay? And then paying for nursing.
So basically, Medicare does not pay for your long-term care costs, only for a limited amount. And then private-wise, they don't cover anything. You got to pay out of pocket. And then Medicaid, you have to spend down all your assets first before you qualify for them. So if you have money in the bank account in the state of Texas, if you're single, $2,000. If you are married, it's $3,000 you can have in your bank account. If you have more than that, you don't qualify for Medicaid. If you have less than that, then you could qualify. They have some other questions they're going to ask you, and then they're going to interview you to make sure that what you're saying is true, and maybe show proof of your bank statements or your taxes, just to make sure that you qualify for Medicaid. But Medicaid, you just don't get Medicaid just because you want it, right? You have to qualify for it. And most of the time, they want you to spend down all your assets before you can qualify for that. So then if Medicare doesn't pay for this, or it's limited, and Medicaid requires you to pay down all your assets before you can qualify for it, Frank, so then how do people pay for their care?
So most of the time, most residents, they paid for those costs using their pension funds, long-term health insurance, or using their own retirement accounts if they have any, or they can use their own savings account, or using their Social Security funds or VA benefits. All of these are considered private pay. So in a way, they're using their own money from any source of income that they receive on a monthly basis to help paying for those costs. And like Jonathan said, it could be very, very expensive.
Well, yeah, if you're asking, my mom said, Chris Queen, she said per person, right? Yes, Mom,
Yes, per person.
That is a per person. So if you have 2 people, you can double up.
Yes.
Yeah, the cost goes
Wow.
up, right?
So about $3,500 per person.
Yeah, or more. Actually, if it's $3,500 a person and you have 2 people, then
7,000.
yeah, you can be 7,000. Now maybe
Wow.
because you are sharing a space, it may be a little bit cheaper, but you still have to pay for the care portion. So maybe you'll pay like $6,000 for 2 people.
That's still
right?
a lot.
It's still a lot.
Wow.
Yeah, because like you would save money on the living space, but you have to get a bigger living space. So it'll cost you more money for the living space, and then you have to pay for the care individually for each person.
Correct.
Yeah.
Oh, is this
So yeah, and that's in Texas. Now, if in California later, I will share with you guys the website that we use. It's called getworth.com. They're very well known for selling long-term care solutions, but you know, we do help people with other long-term care solutions, but I like their website because it's very simple to use, and then it goes by national, it goes by state, and it even has an inflation calculator factored into it to let you know that, hey, if you're going to try to factor inflation into the cost of care increasing over time, it tells you all that stuff, right? So now that we know how we pay for it, Frank, what are the different types of option of care? So if I'm paying for long-term care now, so what kind of long-term care services can I render? Like what kind of care can I be given?
You can use you can render either at a nursing home facilities in Texas, or you can go under a assisted living facility in Texas. So to differentiate the two is that for nursing home facilities in Texas, they provide care for the residents 24/7. So nursing homes are for our seniors who need medical and personal care assistance on a daily basis, 24/7. Seniors with high level medical needs, or those with complex medical conditions, find the help they need in nursing homes. Nursing homes provide long-term care for seniors who require skilled nursing care. So nursing homes are set up to enhance or to maintain the physical, the mental, and the social well-being of seniors who are in need of medical and personal care assistance. Nursing homes provide the most extensive personal care that you can receive independent of a hospital. So that's a nursing home facility for you.
Okay, so
in Texas.
basically, if you need specialized care 24/7, you got to go into a nursing home.
Yes.
Okay, so then you also mentioned like assisted
Living facility.
Can you explain that a little bit, and then we can talk about that?
Yes. So for assisted living facilities in Texas, most of us would prefer that our loved ones live at home where they feel safe and secure and comfortable. There might come a time, however, when staying at home is no longer a safe option for our loved ones. Usually, there will be an incident that brings us to this realization, such as the elder forgetting to take their medication, forgetting to eat their meals, or even just the loneliness associated with living alone. So these communities provide care and housing to our elders who need more assistance with daily care but are not yet at the level of care that is provided at a nursing home. And assisted living communities have grown as an option for our elders who are still independent but require some assistance with daily living tasks. Assisted living communities provide assistance with eating when necessary, medication management, housekeeping, daily hygiene needs and dressing, physical mobility needs, socialization and community activities, and transportation needs. So that is assisted living facility in a nutshell.
Yes. Okay, so let's stop there for a second. Chris had asked if we are going to discuss in-home care and government assistance. Yes, so we'll touch on that a little bit, Mom, to talk about that as well. So we're just now going down the list of different ways that we can get care, right? So besides the main primary one that people usually go to is the nursing home, and that requires full 24/7 around the clock help because you never know what's going to happen to the elder or those who are sick that need more care and need more supervision, need more medical attention. Now, of course, the nursing home is going to be the most expensive,
Yes.
right? Because not only are you living on site, at almost like a hospital, but for an extended stay, but you have 24/7 doctors and nurses attending to your needs to make sure that you're doing okay. A lot of time with the nursing home, I usually see is that either people just get out of the hospital and they're not quite ready to go home yet, and so they move them to this facility or rehab facility, a nursing facility, so that they have continued 24/7 care until that person is well enough, then they send them home.
Okay.
A second type of nursing facility that I usually see is what they call hospice care or skilled nursing care, where a hospice is where maybe you go there for your end of life, right? So maybe the doctor says that your condition is at the point where you are coming to the end of life soon, and they move you to hospice so that you can live out the remaining days as pain-free as possible, right? And that requires 24/7, care as well. Or maybe you are recovering from a serious condition, and you need to have some skilled nursing taking care of you for your particular condition that you have to continue your treatments. Then you'll have these kind of cares. And these are usually the most expensive type of cares. So those are for your nursing. Now, assisted living is kind of similar to those facilities where my brother Alex used to work at, like Brookdale. Some of those assisted living facilities kind of mimic the nursing home, but they have like a structure where it's like an apartment setup. So you have like an apartment-like setup or a condo-like setup, but you have nursing or medical facilities within that area, right? So in the case that they get sick or they need medical attention, then they can go down to the facilities and get treatment or go to the doctor, get checked up, or get the medication given to them. They usually have like a cafeteria on site so that you can eat food there. They do have visitation rights. Depending on your condition, you can leave the campus as well. and you can have visitors. So it's kind of like a hybrid model. It still gives them the freedom that they can still continue to live a normal life, but still have doctors and nurses nearby for you. And also you have a community, which other people very similar like yourself there, so that you can you have friends or you have other people to socialize with. So that they have those assisted living communities. Now, assisted living communities are expensive too. It's not that cheap. You're still going to be looking at those prices that we saw earlier, about anywhere from $3,000 to $6,000-$7,000 a month, depending on the assisted living facility that you're going to. If it's very nice, it's going to cost more money. If you need more help, it costs more money, right? And so all these factored costs are going to be factored in. Before we go into in-home care, Frank, can you talk about the two types of living facilities in the state of Texas that we have right now, and likely other states mimic as well?
Yes, so for the state of Texas, there are two types of assisted living facilities in the state of Texas right now. One is type A. Type A is for those residents who do not need evening or overnight assistance and can follow directions independently in an emergency. So that's type A. Type B is for residents who will need overnight care and will require the facility staff to help them evacuate if necessary. So type B is more dependent, and type A is still be able to follow directions and be more independent.
All right. So when you are looking for a facility, these are some key things that most likely they're going to question you about to see what your needs are, and also the cost is going to be varying depending on what your needs are.
Correct.
Right? But like I said, every state has their assistance resources that you can touch base on. For Texas, it would be www.texas.gov. Mom, in California, California will have the State of California program. I will look it up and I'll send it to you so that you have that. Okay. Besides that, Frank, what other types of care can we receive for long-term care?
Besides those that we just mentioned, we also can go under a daycare centers or a senior center. So what they do in there is they provide meals, social interaction, exercise programs, and dance programs. They provide the older person and the family a respite from personal care. I don't know if I say it right, respite or respite.
Yeah, respite.
Respite, sorry, from personal care, which can help the family caregiver go to work or just take a break from the taxing responsibilities or caring for an older loved ones. Okay. So that's the daycare center.
So daycare center is another option as well. It's that adult daycare. It's kind of like, you want to say, but like when we have kids and we need to drop kids off at a daycare, right? So similar program but for adults, right? So when you have an adult that you are caring for at home, but they're not ready to go into a nursing facility yet, or they don't want to go, or maybe they're not ready to go to an assisted living facility, but you want to retain the beneficiary or the patient at home. Another option is during the day you can send them to a adult daycare center, and in that center they feed them, they make sure they have their medication, they have activities for them to do, they hang out with other friends and other people like themselves, and so that way it gives you a little bit of a break so that you can do your daily activity that you need to do, go to work, whatnot, and then after work you can come back and you can pick up the patient and then bring them home. So then that way you have some options that's another option of outside the home.
Okay.
And what's the last type of care that we have?
The last type of care we have is home health care. So in this case, the caretakers can provide personal hygiene care, meal preparation, light cleaning and transportation to stores, appointments, and social activities. So that's a home health care. So
home health care is I think a lot of people will probably want to try this first, right?
Yeah.
Because you don't want to go to the facility, you don't want to go to a public place. Some people may not want to go, or they're afraid to, or maybe they can't afford to go to those type of facilities. So in-home care is very, very popular. And what they do is that you have a professional come to your house to help. Now, it doesn't have to be a medical professional. It can just be a caretaker, and the caretaker could be licensed, but they're not necessarily a licensed nurse or a doctor, but they're licensed by the state to provide caregiving for qualified individuals. And those caregivers can do things like Frank said, help you prepare meals, help you eat, help you change your clothes, help you clean your house, help you do little things around the house to give you some help that you need that you don't have, right? Also, they can remind you to take your medication and whatnot, but they may have limited skills around medical, but just enough knowledge, right?
Yes.
In case they identify something wrong going on, then they can help call the hospital or take them to the hospital or whatnot.
Right.
And so these programs with these individual caretakers or caregivers, they provide respite for the family members who are taking care of the family, to give them some breaks or so that they can go to work or whatnot. But you have to pay for these people too,
Right.
right? It doesn't come out of the insurance is not going to pay for that. Now, if you have long-term care coverage, they will pay for it, right? Another type of in-home care that they have is they have professional nurses come to the house to take care of the medical portion. Now, sometimes the nurses may do everything together, right? They may do the medical side, they may do the caretaking side, but a lot of times the nurses will just come to take care of one portion, and then you may have a caregiver do another portion, right? I think I've seen some popular setups where if they don't require a lot of medical attention, a lot of time they can have like a family member or a friend or maybe like a licensed person come, and the state will pay for, if you're low income, the state will pay a certain stipend for that person to come, maybe like $12 an hour, $18 an hour, whatever the going rate is in your state. They may pay that person to stay home and take care of the parents or the seniors, but you have to find that person, right? Is someone in your family willing to stay home and not work to do that job? Then you could pick up that job and they'll pay you and you pay taxes on that money. Or you can use that money to hire a qualified individual to come and take care of that person. But a lot of times, because if you're going through the state, I don't think the state will pay 100% of the cost, or if they do, they may only pay a certain amount, and then you kind of like get what you pay for, right? And if you want something more or better, you have to pay the difference.
I see.
Right? So that's talking about in-home care. So all these cares, like why do we talk about these different type of cares? Because depending on the type of care you have, if you're planning for long-term care, you need to have a certain type of long-term care to cover for those costs.
Yes.
Right? And so we're going to talk about the type of the two types of long-term care they have out there. How they pay out is that they have one that is called reimbursement long-term care, and then we have one that's called indemnity long-term care. The difference between the two is the reimbursement. Normally, when you buy a reimbursement type long-term care policy, they may give you a higher benefit, but you have to require receipts. Okay, so you have to show a plan of care from your doctor, and then you have to show receipts of all the things that you're using your care for, and then the insurance company will reimburse you your costs.
Okay.
Right, so hence they give you a higher benefit. Why? Because they're going to ask for a lot of receipts. Means it's going to be a lot harder, right? What type of care that you're going that may require a lot of receipts is if you're going to a nursing home or you're going to an assisted living home. They're going to have receipts, they're going to have invoices, billing, everything is on paper, right? Is all documented. So having a reimbursement policy, if your intention is to go into a nursing home facility or assisted living home facility, that may be better for you.
Yes.
Right? Because no matter what, you go in there, most likely they run it like corporation. They're going to have billing, they're going to have invoices, they're going to have breakdown, they're going to have all the little itemized costs for you, and so that you'll have those receipts. So hence, you paying for a reimbursement policy may be advantageous for you because you're going to get a higher benefit, and then you're going to have all those receipts to cover for it. Now, if you are going to go into like a daycare center or you want to have in-home care, then the in-home care daycare center, you're going to maybe want to lean towards the indemnity type of policy. The indemnity type of policy will give you maybe a little bit lower benefit amount, but they give you the freedom to choose how you use your benefits.
I see.
Right? So you can, they're just going to give you the money. So say if they say, hey, you know what, your monthly benefit is going to be $3,000 a month, they're going to cut you a check for $3,000 a month as long as your doctor certifies that you're on long-term care and you have that plan of care in action. Then you could use it for your home care, or maybe like your daycare center says, hey, you know what, if you pay me cash, I'll give you a better deal. Then you just take the money from the indemnity, because the insurance company is not going to ask for insurance for receipts. They're just going to ask you to give the letter from the doctor, and then they're going to cut a check to you every month, right? And then it's up to you to use that money however you see fit. So you can use it to pay for the daycare center. You can use it to hire your friend to, look over your parents, or you can use it to pay for a family member to stay home to take care of the family member. So the indemnity type of care gives you more flexibility, right? So there's two types, reimbursement and indemnity. So it's good to know that, hey, when I'm looking to see what kind of care I want, do I want to stay in a nursing home facility, assisted, or I want to stay home? And once you know where you want to be, then you know what kind of long-term care policy you should be choosing, right? Does that make sense?
Yes.
Okay. So I want to share with you guys real quick the website that we use to look at some of the costs. And that way you guys, if you guys want to go in there and you guys want to play with the calculator, it's kind of cool that you can play with that calculator and it will kind of tell you how much the cost would be. So let me send it here real quick. Okay, so you want to see the average cost. Every state also, you go to the state website, you can find a lot of information as well. But for government assistance, Mom, you asked about that. We touched on it a little bit at the beginning. Government assistance is basically for those of you who are low income, low asset. You may qualify for the state program. In Texas, we call it Medicaid. In California, I believe they call it Medi-Cal.
Mm-hmm.
And Medi-Cal will have their guideline to qualify. But I believe, in our family's case, I think our grandparents qualify for that. So you would just need to contact the state and let them know that, hey, I do have this program already, but the status of my family member has changed, and now they require more skilled care, or they require more medical attention, and this is their condition, and how can you help us move forward to cover us for the medical care? And then you let them know that, hey, you know what, I know that there's nursing home facility, there's whatnot, and now maybe they may ask a lot of questions to qualify to see that, hey, does the patient need to stay in a nursing home facility at this time? Or maybe they ask the doctor for the doctor's file that say, hey, the doctor, can you certify what kind of care does this patient need? And from there, you will provide that to the government, and the government will decide, okay, hey, based on the doctor's findings, so-and-so needs this type of care, and then they will present to you the different options that you have. If you don't have that yet, then you just let them know, like, hey, this is what I need. They may provide you a minimal benefit, but I think the best thing to do is to make sure you go to the doctor, have the doctor certify the condition. Once that condition is certified, then you can talk to your case manager with the state and let them know, coordinate that with the doctor, so that the doctor can provide all those information to them, and then they can make a decision on what kind of care is the patient qualified for based on the state guideline, right? And then from there, we see that is that kind of care suitable for our family member and what we want as a family. And if that's suitable, then you move forward with it. If it's not suitable, or if it's not to what you want, then you can discuss other options, like say that, hey, you know what, we don't want to go into a nursing facility. We want to stay home right now. What are the options for that? And I think, some of our family members have already experienced like having people come to the home and take care of it. But if it doesn't work, or whatever's not working. If it doesn't work, then you got to be in contact with your case manager and explain to them like what's going on so that they can continue to find the right help for you. But it's not something that just happens like overnight. It's like a trial and error. I remember like my wife's grandparents had to go through maybe like 3 or 4 people before they found the right people.
Mm-hmm.
Right? And then also they even had like my uncle or my wife's uncle staying at home taking care of grandma and grandpa too. So not only were the family members coming over to help out, but then we had someone living in the house taking care of grandparents. But because grandparents had a medical condition, they had to have a certified nurse come check them out. And then also they also had a caregiver, a separate caregiver come to help as well. And so I think some of those costs like the government paid for, but some of it the family paid out of pocket too, because I think the caregiver, the family paid out of pocket for it because the state was already paying for the nurse to come see grandparents, and they were also already paying for the family member to take care of the parents full time. So they exhausted all the benefit limits. So when you ask for additional help, it may not be covered, then you have to pay out of your own pocket.
I see.
Right? And so that's why having long-term care is very important, because you may exhaust, some benefits you may have, and so having that long-term care gives you more control.
I see.
So based on Genworth website, Frank, can you kind of go over what the state, do you have both the state and the national?
Let's see, I have the state
I
right
think
here.
you have the state one. So
Yes.
I'll read the national. So in 2020, the national home health care. Okay, Mom, so this is your question here. The national average for home health care, if you're looking for a homemaker services, full-time is about $4,500 a month. If you want a health aid, it's going to cost a little bit more expensive. It's about $4,600 a month. Now, adult daycare center is a much cheaper option because you're not asking for a lot of time. You're just going there for maybe like 6 hours a day, 4 to 8 hours a day. So you're looking at adult daycare centers are about $1,600 a month. Wow. So that's a lot cheaper option because you're not asking somebody to come to your house and do all these things for you. You taking care of your home situation, and then during the day while you go to work, you have parents to go somewhere, so they have a place to hang out, but then also have someone to look after them. That's going to be about $1,600 a month. Now, if you're going to assisted living facility, the national average for a private 1-bedroom is $4,300 a month. Whoa. Right? So assisted living facility, 1 private bedroom, $4,300 a month. If you're going into nursing home care, well, woo, a semi-private room, meaning that you're sharing a room with somebody, the national average is $7,800 a month.
Wow.
And if you want a private room, you're talking about $8,900 a month, almost $9,000 a month. Even if you plan for long-term care, that ain't gonna cover all the costs.
No.
That's crazy, right? So the cost of long-term care is rising every year. The reason why it's rising is just think about it. In Texas, we only have 30% available, right? And if there's 10,000 people, getting to 65 every day, right? And 70% of those people may go on long-term care. Well, then let's just say that 7,000 people go on long-term care. Well, if you have 90,000 used up and you only have another 40,000 available, it's going to fill up quite quick. And so that means that they're going to have to charge you a lot higher price because the supply is limited.
Yes.
Right? And so they're going to give those long-term care beds to those people that have money first. And those who don't have money and they're relying on the state, they're going to give you last resort, right? Or they're going to give you the bad facility. I don't want to say bad, but they're not going to give you the not so nice facility to stay in because the good facilities are going to be going to those who are paying cash, right?
Sometimes you pay for what you get, right?
Correct. Now, Frank, since we're in the state of Texas, can you give us some of the numbers based on the state of Texas, those costs?
Yes. So the numbers Jonathan just gave us is for the national-wise, but for the state of Texas, for those who live in Texas, the monthly cost for home health care, the homemaker services, as well as the homemaker health aid is about the same amount, which is $4,195 a month. If you go under an adult day health care, the cost on a monthly basis is around $700 a month. And if you go under an assisted living facility, like a private one bedroom kind of deal, is about $4,000 a month. And if you go under a nursing home care and you want a semi-private room, the cost in Texas is about $5,000 a month. But if you want like a total private room just by yourself, it's about $6,400 a month for the private room for nursing home care.
Wow.
So it's a little bit below the national numbers in the state of Texas, but like Jonathan said, we have about 30% left, and the number is gonna fill up quick. So the numbers are expected to go up in the upcoming years.
So let's just say this, Frank. I have California pulled up right now. Mom, since you're in California and you're asking us. So the California, San Diego, California, cost in 2021 right now, if you're looking for a in-home care person to come, it is an average about $5,800 a month. And an aide would take about the same price, right? So that is, yeah. And that's assuming that they're gonna take about 44 hours a week to take care. Now, if you take less, so let's calculate it. If you're saying you maybe get 4 hours a day, times to 28 days, right? So your cost is gonna go down from about $4,800 to about $3,800 a month. That's just 4 hours a day. What happened to the other, how many hours? 18 hours,
18.
No.
Wait, 20.
20 hours in the day, right? So, so that's a big eye opener. For home health care is not cheap, right? It's gone up a lot. Some people think that, hey, if I stay at home, maybe it's cheaper. It's not that much cheaper. It's almost as much as going to a facility. Adult daycare center in California is about the national average, about $1,800 a month. An assisted living facility is about $4,600 a month. And here is the expense.
Wow.
And I understand this is probably why a lot of people in California don't go to nursing home facilities. A semi-private room is about $11,000 a month.
A month.
Semi-private. And a private room costs almost $15,000 a month in San Diego, California for a nursing home facility.
Holy moly.
So if comparing, well, think about it. You're asking for 24/7 care, right? Now let's just say if we just do 14 hours a week, okay, that's about $1,800 a month. Still expensive.
And this is the number for this year. Imagine when we get to that age, Jonathan.
Yeah, I mean, if you're factoring inflation, 3% a year, by the time we retire, this is all going to be like
Double the price, or maybe triple.
I don't know. Let's say
right.
2040.
Yeah.
Yeah, it's double the price. Yeah. So, but you know, we try to plan for at least half, right? We're not trying to say that you should plan for 100% of the costs because it's going to be very expensive. You should try to plan for at least half the cost for your long-term care needs.
Correct. Wow.
Hi, Ann Jimmy. Thank you for joining. I hope you're doing well, Ann. I hope you're going back to school okay. I know you probably with the schools open, you're working again. Hope you're doing well. Thanks for joining.
Hello,
Ko Toang. Thank you for joining our live stream. Thank you for always supporting us. Hope you got your healthcare stuff taken care of already.
He's already taken care of, yes. And
job,
he
Frank.
also referred us a lot of customers.
Thank
this
you,
year.
Ko Toang. You always support us. We love you. We're still waiting for you to come down and
Yes.
See if you can work with us.
Looking forward to it.
We'll see what happens. Maybe you come down, you just retire, you don't have to work, right? Yeah, Ko Toang says that his mom is 91 years old and he gets help from the government. Yes. So state of Texas, they love taking care of seniors, they love taking care of children, they love taking care of women. So if you're one of the three, you're in good luck, right? California, they love everybody. They help everybody that's low income, right? So that's California. So everybody has their own state, but as long as we know how we're going to get our help, that's what's important, right?
Correct.
So we've been talking for about how long?
An hour.
About an hour. So let's go into the last part of our presentation here. We talked a lot about long-term care, what kind of care you can get, how do we pay for it. What is the cost of care, right? We did a lot of scaring, but now let's talk about a solution that we help our clients with, or we help educate our clients with, so that they have another option when it comes to planning for the long-term care. Now that the cost is so expensive, right? It's kind of late to plan for our parents, but at least for our parents, we know that we can get help through the government, right? And that there's ways to do that. And at least it covers for some of the costs. Don't have a misconception that the government is going to pay 100% of everything. Yeah, they'll pay 100% of what they want to pay for, but not essentially what you may want, right? And so just think of it as a supplement. The government's going to supplement your help, and if you want additional help to your liking, to your standard, you may have to pay out a little bit. But if you want your own standard all the way and you don't want to rely on government help until you really, really need it, then you should plan for your long-term care early, and there are some options that we want to share with you.
Yes.
So Frank, you go ahead and lead up for that.
Okay. Let's give me 1 second. So for long-term care. Okay, so long-term care, you can. There's multiple ways you can get a long-term care. Either is a separate standalone long-term care package, or you can get life insurance with the long-term care option.
So before we talk about this option, which I'll talk about, but Frank, tell us how, if you buy life insurance, how do you get long-term care or life insurance?
Well, so long-term care now could be a rider that is added onto your life insurance. So just make sure when you talk to your advisor or your agent, just make sure that, hey, I also need long-term care as well. And then as an advisor, we can help you get a life insurance life insurance policy, and also a rider with the long-term care as an add-on.
Got it.
And from my experience, normally if you buy this policy and at some point in time that you need to go under long-term care, the insurance company, they pay around from 2% to 4% of what your death benefit is on a monthly basis, and they're gonna keep sending you money so to help for the medical costs until you exhaust the death benefit or until you recover.
Okay.
So that's how long-term care with life insurance works. And even after you use up all the death benefits for long-term care, and when you pass away, I think they still pay you about 10% of the death benefit to help paying for the funeral costs.
Great. So just let me summarize here. So life insurance now also, besides just having a life insurance protection, you can add on a rider that allows you to have long-term care protection as well.
Correct.
And how they use the benefit is that they take it from the death benefit to give you that benefit while you're still alive, so you don't have to wait till you pass away.
Yes.
Okay. So for example, ladies and gentlemen, they said that Frank said that you can get 2 to 4%. Let's just use 2% for example. So say for example you have a $100,000 life insurance policy and you have a 2% long-term care rider or 4%, then they give you the $2,000 to $4,000 a month to pay for your long-term care costs. And if you're $2,000 to $4,000 a month, that already covers you quite a bit already.
Yes.
Right? Because that's about the average cost there. So if you're taking 2%, which is $2,000 a month, then it'll cover you for about 4 years or so, right? If you're taking about 4%, a higher amount of that $100,000, you get $4,000 a month, you get coverage for about 2 years.
That's still
which is still a good amount, right? Just for $100,000, if you need more, you bump up the coverage, right? Now, from what Frank is saying is that whatever you use, they'll deduct it from your life insurance. So say, for example, you went on long-term care, but you recovered, and you only use half of that money. So you use $50,000, but when you pass away, they deduct that $50,000 out of your life insurance of $100,000, and you still have $50,000 that you're going to give to your family. Now, what if you use all the long-term care, $100,000 of long-term care, and you pass away? Well, you're not going to get $100,000 anymore. You're going to get 10% of what you originally bought, which is $10,000. So they still give you something, even though you used all the money for long-term care already.
Yes.
Right. So the nice thing about life insurance is that if you don't get sick, you still have the life insurance policy, right? But what if you don't want to wait till you die to use your benefits? Well, you have the long-term care.
Correct.
Right? It's awesome. So I know you love life insurance, Frank. If anybody has questions about life insurance, Frank is the expert on that, and he's helped a lot of families this year with getting their life insurance. Some people with long-term care, some people without. It just all depends. But thank you for protecting our clients.
Thank you.
But let's talk about the next option, Frank.
The next option, give me 1 second. Let's see where it is. Okay, so the next option is to consider a linked benefit policy. So unlike a traditional long-term care policy, a linked benefit policy offers more than just long-term care benefits. It's linked to a life insurance policy with a death benefit, typically equal to or more than premiums paid. That means the benefit is paid whether you need long-term care or not. Okay, so I think we just talked about the life insurance with a long-term care option.
Okay, so basically what Frank is talking about, a linked benefit means that it's still a life insurance policy, but this type of product for long-term care, it is focused more on long-term care, less on life insurance, right? So when you buy life insurance with long-term care rider, you're really buying a life insurance policy with the add-on long-term care, right? This policy is a long-term care policy that is based off of a life insurance policy, but the life insurance benefit is lower and they give you higher long-term care benefit, right?
Okay.
So that why do people do this is because they want more long-term care benefits. They want a death benefit in case something happens, like what if we don't get sick, right? What if we don't get sick and we don't use this money, like what do I have, right? So you still have a life insurance policy, some life benefits. And then the third thing is that you have liquidity in your product, is meaning that if you don't use this product and if you go past a certain time frame, it's fully refundable to you.
Wow.
Right? So if you put in X dollars on it and say after 5 years and you've gone past like the vesting schedule and you end up saying, you know what, Jonathan, I'm so healthy, I don't think I need this and I don't care about life insurance because I already have my own life insurance policy, give me back my money, right? The insurance company will give you back your money in full.
Wow.
So you don't lose a dollar. You don't lose nothing. Now, of course, some people may argue that, hey, I didn't get like interest earned in the account. Well, hey, because initially your main goal with it was to leverage against long-term care. So you were trying to make the money or the ROI on the long-term care, not putting this in and thinking that you're going to grow your money with it. But as a backup, if you don't need it, you get all your money back. You don't lose anything.
I see.
Right? So that's a nice option there. So this is called a linked benefit. Can you let people know what they can use the linked benefit for, Frank?
Yes. So the linked benefits, you can use it for caregiver support, a home care and housing options, assisted living or nursing homes, adult daycare, the memory and Alzheimer's care, end-of-life care, meal and nutrition services, safety and adaptive equipment, and transportation.
Wow, so basically this type of life insurance / linked benefit, what we call it long-term care policy, can take care of basically all the type of cares.
Yes.
Right, so we can use it for everything. It's an indemnity type of long-term care, so it has a lot of flexibility that you can use it for all the type of cares that you need when it comes to long-term care. So to go to the next page here, I want to talk about how the product works. Okay, so how I did this was I solved for the benefit of $3,000 a month because it seemed like it's a little bit below the national average, but because how this product works is that they give you a certain benefit from day one. And so from day one, what they're saying is that if you have $60,000, okay, from day one, they're going to give you $3,000 a month benefit for 6 years. So if you gave $60,000 to the insurance company, and from day one, if something happened to you on that very first day, they're going to pay $3,000 a month for the next 6 years. And basically, you just turned your $60,000 into $230,000. And that's about 4 times.
Wow.
So from day one, if you took a piece of your 401k or you took a piece of your savings out and you said, hey, you know what, I want to leverage this money, from day one, you leverage 4 times what you put into it. And this person how old is this person? I believe this person was
80? HAD.
No. I think this person was 55 years old. Female, 55 years old male.
Okay.
Okay, so day one, you put $60,000 in. You have $230,000 of benefit, which is $3,000 a month. Now, how this benefit works is that, hey, we don't know when we're going to go on long-term care, right?
Mm-hmm.
So every year that you don't go on long-term care, the benefit increases. The daily debt benefit of $3,000 increases 3% every year.
Wow.
To try to keep up with inflation, right? We don't know how inflation is. It could be 3%, it could be 5%, it could be 6%, but we're just assuming 3%. And so they calculate this on a 3% simple interest. So every year that you don't go on long-term care, this benefit increases going up, right? And so let's just say that you got to the age of 80,
Mm-hmm.
and you have this 3% increasing simple every year. By the time you're 80 years old, more likely that you're going to be in long-term care, you will have $5,250 a month of long-term care benefit. So your $60,000 that you put in, if you didn't go on long-term care until 80, your benefit now is at $400,000 for long-term
Wow.
care. Right? Now, I don't want you to be confused. You see the big number, you say, oh, I put in $60,000, now I'm gonna get $240,000 today, give me my money, $240,000. No, it doesn't work that way, okay? Oh, I put my money in there and I'm 80 years old now, I wanna cash out $400,000. No, it doesn't work that way. This is for long-term care qualified costs, okay? So if you're on long-term care, you can take out the benefit. Okay, so you've got to qualify for the condition of long-term care by your doctor. It's not just you become that age and then you get to cash out. It doesn't work that way. It's not that type of product. Okay, so you put in $60,000 from day one. You get $230,000 of long-term care benefit, $3,000 a month. Every year it raises 3% a year. If you wait till the age of 80, then you go on claim. Then you get $5,200 a month, which is equivalent to about $400,000. Now, if you use up all the benefits, they still pay a residual benefit for you of $14,000 to pay for like your funeral costs and whatnot. So you still do have a residual benefit, kind of like what Frank's product said about the life insurance. You get like 10% of whatever you put in initially. This long-term care product will give you a $14,000 residual benefit. Now, if you pass away, okay, from day one, they will always pay you out whatever you put in plus more. So in this case here, the life insurance policy on this one, on the life insurance portion, is if you pass away and you didn't use your benefit, they're going to pay $72,000. So automatically, your family is going to get more than what you put into it, right? So that is the benefit. If you pass away, the life insurance portion of it, they pay you $72,000. Okay, so this is just an example of one product here. I think it's a very powerful solution if you're looking to plan better, is that, hey, you know what, I already have life insurance and I don't want to mess with my life insurance policy, and I have extra money to do a separate long-term care policy. This is very good because you can start out with a lower cost and then you can scale up over time, and then you just focus on preventative care, take care of your health so that you can get a higher benefit as you get older, right? But in between, if something happens, you know you have some form of benefit more than whatever you put in. In this case, for this person, they put in $60,000, they leveraged 4 times what they put in, right?
Wow.
And if they waited until 80 years old to use their benefit, then they would have leveraged almost 7 times, 6.6 times what they put in, right? And that's great. Where are you going to find $400,000 for long-term care costs? Because if long-term care costs $5,000 a month and you had $400,000, right? That would last you about 6 years. 6 years of coverage. And that's way more than enough, right? So you can always tailor these things too. If you don't think that you're going to live that long after you go on long-term care, you can skew down the benefit years maybe to like 4 years, 5 years, 3 years, right? And then you'll lower your cost to get in, right? And those are some things that you can sit down with your advisor, your agent, to discuss customizing your plan to your need, but we just ran you like the standard numbers just so that you have a general concept idea of how it would work, okay? And then, you know, you sit down with your advisor, you sit down with us, and then we can help you, you know, tailor a program that's custom for you,
I
okay?
see. Thank you, John.
Okay, so that pretty much it for our presentation today, or live stream today. Thank you everybody for jumping in and saying hi. Thank you, Kotoang. Thank you, Mom. Thank you, Frank's mom, for participating with us today. We really appreciate your all support. We'll still continue to do the live streams until Christmas season, so it's not quite yet. But Thursday we'll do the live stream in Vietnamese. And so that way for those Vietnamese viewers who don't understand English quite as well or some of the terminology we use, we'll do our best to explain it in Vietnamese on Thursday, right? But that's pretty much it for today. Frank, you have anything to say?
I just want to say thank you everyone for attending to the live stream and looking forward to see you again in the Vietnamese version on Thursday.
Awesome. So we'll see you guys all soon. Make sure you tune into our channel, subscribe, like our page, our YouTube page. It really helps us a lot. Thank you for joining us. This is the Paramic Hour, Jonathan, and I'm out.
See you.